Less than HR, greater than whooping cough, also known as pertussis, has seen an alarming resurgence in Canada, with Quebec at the epicenter of this outbreak. Public health experts are sounding the alarm, describing the situation as an epidemic. As of the latest reports, Quebec has recorded over 12,000 cases of whooping cough since the beginning of the year. This figure marks a significant spike compared to pre-pandemic averages, where fewer than 600 cases were typically reported during the first 8 months of the year. The increase in cases is not confined to Quebec alone. Other provinces are also experiencing notable rises in pertussis cases. For instance, New Brunswick has reported 141 cases so far this year, a sharp increase from the average of just over 30 cases annually. Prince Edward Island and Newfoundland and Labrador have also declared outbreaks in recent months. In Ontario, the number of cases has more than quadrupled compared to the average for the first 6 months of previous years. This surge in whooping cough cases is partly attributed to a disruption in the typical cyclical pattern of the disease, which usually peaks every 3 to 5 years. The COVID-19 pandemic and the associated public health measures may have altered this cycle, potentially leading to a backlog of cases. The enhanced testing infrastructure set up for COVID-19 could also be identifying more cases of whooping cough that might have otherwise gone undetected. Whooping cough is particularly concerning for young children, especially those who are unvaccinated or have incomplete vaccination schedules. The illness spreads through respiratory droplets and is characterized by severe coughing fits that can be exhausting and, in some cases, dangerous. While most individuals recover without hospitalization, the disease can be fatal in infants, which underscores the critical need for vaccination. Health officials are urging parents to ensure that their children are up to date with their vaccinations. The standard vaccination schedule includes doses at 2, 4, 6, and 18 months, followed by a booster around age 4 to 6 and another in the early teens. For adults, particularly those in close contact with infants, a booster is also recommended to help protect the most vulnerable populations. In summary, the surge in whooping cough cases across Canada, particularly in Quebec, highlights the need for vigilance and adherence to vaccination schedules. As schools prepare to reopen, ensuring that children are protected against this serious disease should be a top priority for all families. Stay subscribed for more videos.